logo for the NIH National Cancer Institute Division of Cancer Control and Population Sciences. Guiding the Future of Cancer Control, a retrospective from the Director of the Division of Cancer Control and Population Sciences.
Hello everybody, my name is Bob Croyle. I've been serving as the Director of the Division of Cancer Control and Population Sciences here at the National Cancer Institute. And I wanted to take this opportunity as I anticipate my own retirement from the NIH to reflect back a bit on my tenure at NCI. I also want to reflect a little bit on some of the accomplishments of the division over the past several years, and also share my excitement about new leadership coming in for the division. This year, one of the major accomplishments we're really proud of is the substantial expansion of our SEER registry.
A map of the United States showing the areas in which the SEER registry has been expanded. The highlighted locations are labeled as areas of research support or core infrastructure. SEER is the gold standard in cancer surveillance. It has 18 central cancer registries and represents approximately 50% of the U.S. population. The SEER program receives more than 800,000 cancer cases annually. SEER program registries collect data on patient demographics, primary tumor site, tumor morphology and stage at diagnosis, first course of treatment, and follow-up for vital status.
The SEER program has now expanded to cover 50% of the entire population of the United States. These have turned out to be really valuable resources, especially for health services researchers, but also for epidemiological research and research on a whole variety of special cancer issues like rare cancers and cancer survivorship and survival. I'm really proud that in the last few years in the division, we've really grown health disparities research in a truly remarkable way. We've doubled our research funding for research grants focused on health disparities research questions.
A graph shows the increase in overall health disparities portfolio over the years. From 2010 through 2020, the overall health disparities portfolio increased from roughly 34% to nearly 75%, nearly doubled the amount of grants from 300 to just under 600, and grew research grant funding from $150 million to just over $400 million.
The NCI has really led the way for the entire NIH in the development of the field of implementation science and providing a whole range of training to increase the number of investigators who are well-versed in this area, but also putting out special funding announcements and supporting initiatives like the Implementation Science Research Centers, which is a signature element of our implementation science research program.
The Implementation Science Centers in Cancer Control develop, test, and refine innovative approaches to implementation, advance methods in studying implementation, and develop reliable measures of implementation science.
Our healthcare delivery research program, health services research, health outcomes research, all the methodological research, and the data resources we've created have demonstrated the importance of NCI providing evidence to inform policymaking as it relates to cancer care and cancer treatment.
Recent major scientific initiatives include IMPACT, improving the management of symptoms during and following cancer treatment, health measures, transforming how health is measured, PRO-CTCAE, AYA Hope, Promise, SEER CAHPS, and SEER MHOS.
Another area of research that we've continued to grow within the division is cancer survivorship research. The Office of Cancer Survivorship was created in 1996. And so when the division was created in the following year, the office was placed organizationally within the division. So the survivorship research portfolio has continued to grow. The behavioral research program covers a wide range of areas from tobacco control research to health promotion, health behaviors, health communication, and also basic behavioral science. And especially in the recent work on COVID, it's a real strong illustration that unless you address behavior and the psychology of health behavior, you're really going to overlook a lot of factors that are critically important to public health and prevention.
Up to 50% of cancer deaths are attributable to behaviors such as tobacco use, unhealthy diet, lack of physical activity, ultraviolet exposure, and alcohol consumption.
In epidemiological research, we spent a lot of efforts in the early years of the division building large international consortia to facilitate collaboration across many countries among investigators who are interested in molecular epidemiology and in gene-environment interaction. More recently, we're recognizing that we really need to step back and focus on building and, in fact, rebuilding our portfolio on environmental epidemiology, particularly the effect of toxins and the exposure to toxins in the development of cancers.
The Epidemiology and Genomics Research Program identifies genetic, constitutional, and environmental factors associated with cancer risk. How do our surroundings impact cancer risk? Lifestyle factors, infectious agents, physical and chemical agents, and social and built environment.
As I look forward to my own retirement, I'm also reflecting on the incredible accomplishments of the team we have here in DCCPS. And I really look forward to the new leadership from Dr. Katrina Goddard, who I think is going to be a terrific new director and also has a lot of fresh ideas about how to pursue cancer control research and its application to benefit the nation and the world.
Learn more at cancercontrol.cancer.gov, NIH National Cancer Institute, cancer.gov, phone number 1-800-4-CANCER, October 2021.